Well, welcome to the show, Dr. Gerry Curatola and Dr. Jeannie Grecco, my people. Welcome to the barn.
Thank you. Thank you for having us.
I am so happy to have you guys here today. I feel like this is a long time coming.
Sure is.
When I was reflecting on my healing journey, I was thinking about how 6 years ago, maybe a little over 6 years ago, my healing journey started because of a tooth. And I really went on a dental journey. It was a real ride that I went on. And along the way, I really realized how important the mouth-body connection is. And I don't think many people out there realize this. And I learned a ton of information along the way. I was like joking today. I was like, I feel like I could be called like Dr. Wright, like with the amount of dental knowledge and I know. I don't think it's normal how much I've learned in this process.
Dr.
Yes.
Wright. Much better than
Yes,
Dr.
three of us. That's true. The three amigos. But I think for sure, listeners today are going to take away a tremendous amount of valuable insight and at a minimum, handle traditional measures with a more biological perspective and perhaps advocate for themselves in a different way. I think that will be the minimum goal. But I think everything that we're going to get into is going to really open up people's eyes and expose them to some different elements when it comes to dentistry.
Absolutely.
So I have a little intro for you guys that I want to share. So we have Dr. Gerry Curatola, who is a world-renowned biological dentist with nearly 4 decades of experience as a clinician, a researcher, an educator, an author, and humanitarian. You're also the founder of Rejuvenation Dentistry. You have a gorgeous office in New York City, which is the office that I see. You also have another beautiful location out in the Hamptons. And you have an epic collection of very vibrant eyeglasses that I am here for. Today you're blessing us with blue, and I think
This is my favorites.
they're the most perfect accessory, and I think they're fabulous. And I think it's part of your vibe, and it makes me smile, and I love that about you. But listen, this is just scratching the surface. You have a vast education and understanding of dentistry in general in the traditional space. And in my opinion, I feel that you are one of the pioneers in terms of helping to lead and change the traditional landscape to a more biological perspective. And I think being in that position takes courage and it takes a leader. And I feel that you are one of the GOATs in the industry. And I am very, very grateful to have time with you today. And I'm just really, really happy for you to be here with us.
Thank you.
And you, my friend, so noted on the Rejuvenation Dentistry website, it says, when you choose Rejuvenation Dentistry, you're choosing more than a dentist. You are choosing a partner in your journey to optimal health. And that couldn't be more of a perfect way to introduce you, Dr. Jeannie Grecco, who is a biologic restorative dentist for adults and for little guys, kids. You have been literally that for me. You have been my partner. You have literally been my ride or die. You have been my advocate. You have been in every room with me for every procedure that I have had from the very beginning. You had literally held my hand through procedures. You have been in the room with me when I wouldn't have been with other team members, working through procedures. And the biological industry space, I think, is very lucky to have you as well. You lead yourself in your life just as a human with integrity and authenticity. And you bridge both the traditional landscape and the biological landscape. And you are also a fellow Virgo. So we are cut from a certain cloth. And I am equally as grateful to have you here today.
Thank you, Lauren.
So before we get into the nitty-gritty of all the questions, I want to share a little bit of a paragraph that I think is going to set the tone energetically for what we're about to get into. At Rejuvenation Dentistry, we believe that oral health is the foundation of total body wellness. Our approach is rooted in the understanding that every patient is unique and shaped by a combination of genetic, biologic, biochemical, microbial, and psycho-emotional factors. True healing is achieved by honoring the intricate connection between mind, body, and spirit. And I want to pause there. This is why you are my dentist. And I think every human being deserves medical professionals that approach them as humans and their medical situation from a perspective of mind, body, spirit. And imagine if everyone could have that interaction, the healing that could truly, truly occur for people. And I think that this beautifully sets us up for what we are about to get into. So are we ready?
Yes.
Yeah.
So many dentists in the field claim to be biological dentists simply because they remove mercury fillings. What makes a true biological dentist biological?
That's a great question.
Yes.
One of the favorite things that I do, especially when I'm mentoring younger dentists, and actually Dr. Jeannie Grecco will remember this. Now she's we're coming up on a decade together, you know,
Yeah.
so,
Time flies.
It sure does.
Yeah.
but, you know, I walk around and, you know, dentistry is one of those professions where, you know, you really get trained more to be a mechanic of teeth than a physician of the mouth.
Yes.
Dental school is very much that. And, you know, what's interesting is that when I graduated dental school over 4 decades ago, one of the reasons why dentists got into trouble and really had malpractice cases brought against them was the failure to diagnose periodontal disease, because all they looked at was teeth. Forget about the mouth-body connection. So in 1983, I enrolled in this master's program in holistic health, and the chiropractor who was the first functional medicine doctor I ever heard of, Dr. Alan Pressman, put this group of people together. One of them was the renowned nutritionist, Gary Null. He had a radio show, and he was big in holistic nutrition. So a lot of it was geared toward understanding, you know, nutrition is fundamental, not just to systemic health, oral health and systemic.
Right.
But that started me on the journey. But then it was mid-90s, 96, 97, I got an invitation to Harvard Medical School for complementary and alternative medicine. And that was really interesting because it was open to all healthcare practitioners. And I was like, finally, you know, they're recognizing dentistry is not separated from medicine.
Right.
Well, I get up there and it's day one. Guy sitting next to me goes, "Hey, I'm Bob." And, you know, and I said, "Hey, Bob, nice to meet you." I said, I'm Gerry Curatola. And he goes, "Hey, Gerry, nice to meet you. What do you do?" And I said, "I'm a dentist." And he goes, "What are you doing here?"
Yeah.
And it was like, I was like incensed. And I was like,
Yeah.
Bob,
Well, Bob, let me tell you, Bob.
this is not disconnected from
Yeah.
this. And I actually befriended an RN who was a critical care nurse who was there. And she became a dear friend from that time. I became her patient. She went into functional nutrition. And my daughter Gia was suffering constantly with sinus infection. She was a young teen. And it was like sinus infection, and it was like antibiotic. And I was like, we got to stop this.
Yeah.
I sent her to Barbara, this woman, Barbara. Barbara sees her, you know, cleans up her diet. She never had another sinus infection.
Yeah.
But then she comes to me, and, you know, she became my patient. And the next thing you know, she said, "Gerry, there's a change in my medical history. I was diagnosed with breast cancer." And I was like, "Whoa, you know, what?" I said, "Really?" I said, "Oh, you going to Sloan Kettering? You're going to get worked up at Sloan?" And she said, "Hell no, that's a meat grinder. I'm going to Switzerland to Dr. Thomas Rao, who is the father of biologic medicine. He wrote the textbook on biologic medicine." And without skipping a beat, she looks at me and said, "You need to meet Thomas. You need to know Thomas." And I'm like, "What?" She said, he's the first MD that I ever met that if you had breast cancer, prostate cancer, lung cancer, autoimmune disease, chronic Lyme disease, rheumatoid arthritis, or anything, the first thing he says is open your mouth.
Wow. Wow.
And I was like, I got to meet this guy.
Yeah.
And that's when I went over there. So when we talk about,
That to me feels like a universal moment of synchronicity. Like it was the beginning of following the breadcrumbs of this journey for you.
it really was. And, you know, and 20 years later, I was invited to give a keynote address in Porto, Portugal, to the International Congress of Functional Medicine. There were 700 doctors, mostly MDs in New York, and Thomas Rao came to my lecture to hear me.
I love that.
And he was sitting next to my wife, and he's in there, and I said, there's one medical doctor in this room that changed my life as a dentist, who made me understand the intimate connection between the mouth and body, which is why I wrote the mouth-body connection. And I really wrote it for the layperson, but I have so many dentists who tell me, Gerry, thank you. You know, I learned so much from that book that I never heard in dental school.
Yeah.
And when I gave the subject, one medical doctor changed my life here, and that's Dr. Thomas Rao. He's the first one that if you see systemic disease, many of those root causes, the body's number one source of chronic inflammation or toxicity is in your mouth.
Yeah.
And anyway, so he said, to my wife when he was leaving the lecture, "Tell Jerry it was a very good talk." It was cute. But anyway, so really biologic dentistry is rooted not in, I mean, there was, a lot of holistic dentistry, which I never wanted to be associated with because I always felt like they weren't really serious clinicians. They weren't really good. Many of them, there's a lot of biologic dentists who are not good dentists.
Yeah.
And there's a lot of good dentists who are not biologic. And what I found is when you take a really good dentist like Dr. Grecco and mentor them in biologic dentistry, they come out superb and practicing with a higher level of consciousness and a higher understanding. And I'm glad you paused on the mouth-body connect, on the mind-body, on the mind-body-spirit connection. There's the mouth, mind, body, spirit.
Yeah.
That's it.
It's unfortunate.
But I'm glad you did that because one of my favorite things is to walk around my clinic and remind a young dentist that they're working on a divine life force. Right. They're blessed to be able to minister to a patient that is a living life force, because that's what biologic medicine is rooted in.
Right.
It's rooted in this belief that we have this biologic field. It's a divine life force. That's our spirit.
Yep.
Our spirit is not woo-woo up there. We can quantify it. We can do muscle testing. We can actually speak to it.
Yeah.
And really understand that you're this spiritual component in this incarnation of this body with this consciousness of our mind, this holistic, triune, multidimensional life force we have is essential for understanding health and disease.
Yeah, and what a gift to be on the side of the medical side, to be able to identify a root cause, remove it, allow the person to heal, and to bring their life force back into flow. I think that is like a real gift.
And that's my book that I'm writing right now, the sequel right now. It's called The Coherence Cure, Understanding Coherence. It's beyond the mouth-body connection.
Yeah.
Understanding coherence. And coherence is this alignment in mind, body, and spirit.
Yeah.
And there's a lot of lack of coherence, both, in ourselves and certainly in the world around us. Coherence.
It's true. So it is definitely true that there is a massive connection to the mouth and to the body. And I think we're going to get into a lot of this. One area that I think is very loaded that I want to get into is root canals. And there's a few different canals that we're going to go down with this. You like that? I like to practice that. I had 2 root canals performed 25 years ago when I was a teenager. I think I bit into a piece of candy, and over the course of time, I had 2 cracks in the teeth, and I didn't know what I didn't know at that age. Certainly did not know at a young age. And I had the 2 root canals performed. Years later, so about 6 years ago when my healing journey started, I had an infection that sprouted in the 1 root canal, which for me, I remember in my quiet thoughts, I was like, but that's interesting. Why is an infection sprouting? I had a root canal. In my mind, I was like, when the root canal, it's done. The tooth is done in my mind. So why is something sprouting? And that was the beginning of my whispers and my quiet thoughts of the universe saying to me, something's not right. I relied on my local traditional dentist who advised me to have a second root canal. I didn't know what I didn't know. I went through with that procedure, and then hell broke loose. I started having thyroid issues. I started having gut issues. Every time I eat food, my skin was burning. I was breaking out. I was breaking out in hot flashes. And nobody was connecting dots. Everyone was operating in silos. There's no way, Lauren, that your tooth is connected to your thyroid and to your stomach. And it was extremely emotionally and mentally challenging for me. After we wrapped up the second root canal process, the infection came back, and that's when I popped off. When they offered me the opportunity to go in for a third procedure and clip the top of my gum off, or the root off, I said, I am getting off this hamster wheel to hell. And that's when I started researching biological dentists and when I discovered rejuvenation dentistry. To your point earlier, there are a lot of people out there that claim to be biological, and the vast majority are not. I will honestly say I looked into a lot of people, and your practice was, for me and for what I needed, was the only practice that resonated deeply across the board and what I needed. So I'm very intimately aware of the root canal process. I would love for you guys to share with listeners, is a root canal ever a good option to preserve a tooth?
I can take this one.
I don't want to take that.
That's okay. So root canals are a hot topic for good reason, right? If somebody has there are two reasons why, more than that, but two big reasons why root canals are done. One is, okay, there's a deep cavity. It's approaching the nerve. Let's clean it out and do the root canal. Now, every case is personal. Every case is very specific to their current status and when, what is their medical status and, what is going on in their life where they are able to either address this issue now or not. And then there's the second situation of, is it a child? Did they fall? Was trauma, incurred to this tooth? That means that there really wasn't an infection. Do we want to hold on to this tooth for developmental reasons, et cetera?
Right.
But the root canal, the trauma.
Not all root canals are bad.
Honestly,
Right.
We talked about that too. Like mine lasted a very long time. I would have preferred to have gone my whole life until I did it.
there were a lot of well-meaning endodontists
Yes.
who are root canal specialists.
Right.
Well-meaning because dentists really, we're in the business of saving teeth, right? We're in the business of helping patients. And root canals seemed like a brilliant thing. I think back to when I came out of dental school and I was taking my boards. I was going to move to Florida, and then a dentist died of a heart attack on 58th Street. And the practice was left unattended. It was unattended for about 3 or 4 months. People were getting these toothaches and everything like that. And I was a young dentist right out of school, taught that endodontic therapy, root canal therapy saves a tooth. And you know what? These people were dying in pain.
Yeah.
And you did a root canal, it got them out of pain. Next thing you know, I was a hero. But what I would say now, knowing what I know biologically, a root canal is a temporary procedure. It is the only procedure in the history of medicine where we keep something dead in the human body.
Like literally the way, and the way that I equate this is if you were to get hyperthermia on your finger and your finger goes black, but you just keep changing, but you just keep changing the nail polish. Like that's how I envision it.
It's true. So with root canals, just to even answer your question, we take cone beams now. And then there are, requirements. You're supposed to take a cone beam on a root canal every 1 to 3 years. These are recommendations for good reason, because now we know that if a root canal does sprout an infection, that can be a source of low-grade chronic inflammation systemically. It could be spiking your C-reactive protein. It could be causing a systemic issue that we are unaware of. So we monitor them very closely.
Yeah.
It's not just that every single one of them needs to come out. And yes, to your point, some people really do need to be taken out of pain, and that maybe that root canal will last them some time, but we don't know what their current medical status is or if it's going to change.
Yeah. And I think that's such an important point that you were mentioning before. You were alluding to the emotional component of it, because it is a very emotional. Pulling a tooth is not easy. And so perhaps doing a root canal might emotionally be what you are better suited for. And you might go the distance and you might not. I unfortunately did not go the distance. And then I had to make a really big decision on what I was doing. But I think it is a very loaded situation. But I think what's most important is that it's a bio-individual situation where you are interacting with a medical professional who really can provide both sides, where you feel safe in what you're executing and you know what might be coming down the pipe. And if you are already perhaps dealing with medical issues, or if something sprouts, don't ignore what might be happening in your mouth.
And that's the point. There is no one size fits all.
Yeah, I agree.
And it's not, and I will say that, from a biologic standpoint, root canals are not considered a biologic procedure. It is considered a patch. And I consider it a patch. I mean, I have, some great friends who are endodontists, and they hear me talk about it. I'm like, guys, the future is in regenerative medicine. Not in taxidermy for teeth. Which is what a root canal is. It's embalming the tooth. As a matter of fact, when I came out of dental school, and I keep dating myself, but when I came out of dental school, they were using, it had just been banned, but they were using something called Sargenti paste, which had formaldehyde. They're putting formaldehyde in the tooth.
Yeah, that's
not, a formaldehyde-based paste to embalm the tooth.
Yeah.
And, 100% of endodontically treated teeth, root canal teeth, will release endotoxins greater over time.
Yeah.
So, and to Dr. Grecco's point, she made a really good point, because she said, sometimes if you break a tooth, it's really exposing the nerve, and it's a sterile tooth. And many times it could be a young child who's 9 years old,
Right.
that tooth is, it's always gigantic. Their head kind of grows into their teeth.
Yeah.
But, in that case, it's a sterile pulp. You could endodontically treat that tooth, get a pretty stable result, save that tooth while the rest of the dentition is erupting and forming in the mouth, so that you don't now have space issues and all around.
That makes a lot of sense.
The way to keep a space is save the natural tooth.
Right.
But if that tooth was grossly infected, if there was an abscess, if there was autoimmune disease or other things that were happening, that's something else. I mean, I'll give you a quick story about how an endodontically treated tooth, and maybe we could save this for later when we talk about meridians.
Yes.
What
Yes.
we're
We're gonna get to
I'm
that.
sorry,
Yeah.
that question on there.
Yeah.
Yes.
Yeah. We're going to
But at any rate, so we really have to understand that we're dealing with a lot of, when I was in dental school and we were in dental school, a lot of it is black and white.
Yeah.
And then you get into practice and there's a big gray area. But it's really important to understand the principles of biologic medicine and biologic dentistry.
Right.
That the human body has this incredible capacity to self-regulate and heal when we respect that life force.
Yep. I agree.
And that life force, has, we don't live in a perfect world. Lots of compromises, including what goes on in the environment around us, in our own lives. And that's what I try to get across in my book, The Mouth-Body Connection.
Yeah.
And
And I
I'm
think
going to have a copy of the book here. I know.
we will definitely share the love with it.
Yeah.
And I think the gray area that you guys live in, that most of the traditional world might not be living in, is when people see biological dentists is because something is not right.
Right.
So you were hearing very much on the back end of it,
Yes.
issues that people are having.
Yes.
Is a second root canal on the same tooth ever a good idea? Never. Yeah. Okay. So I was put on a roller coaster straight to hell.
It's,
You were going straight to
Straight to
the
hell.
highway to hell.
I literally was on a highway to hell.
Well, you think about, how often does this really work? But then you also really have to think about the person in the chair. Do they really want to spend more time trying to save a tooth that's going to reinfect?
And money,
And
too.
it's money.
It's like
and
insane.
money.
Whoa.
Exactly.
It was.
The retreat is as much as the dental implant.
Yes,
A lot of people
absolutely.
still have a dental implant
Right.
rather than
100%.
the root canal.
100%.
Tooth that will not work.
Biologic dentistry, like to your point, gets a little bit of a rap for being costly because we use really high quality materials. But why are we spending more time and more money on teeth that we know are going to fail?
Well, and at that point in time, when everything was through insurance and through traditional medicine, I was still paying a tremendous amount of money. So it's like, let's start making smart decisions, Lauren. Like, this is not working for us anymore. After pulling a root canal, can you leave the space empty, or do you need to do a dental implant? And talk a little bit about the sinus cavity floor that I don't think people even know to even think about. I had to think about this.
Yes, you did.
But let's talk about, because I think for a lot of people, especially too, if they're the furthest back teeth, a lot of people think, well, if you can't see it, just leave it. And maybe that totally works for situations.
Yeah.
But
Another great point that Dr. Grecco made was something called the CBCT. And a lot of people don't know what that means. It's a 3D view of your mouth, of your head, of your jaws, of your sinuses, of the mandible, the entire mandible, of your joint, the temporomandibular joint, and now the newer CBCTs, you can see the airway, which is another very big, important area in biologic dentistry, is understanding airway disease and how to correct an airway for people who are, have obstructive sleep apnea, which is, you have a 21 higher chance of cancer with obstructive sleep apnea. That's a new study that just came out.
that is very interesting.
Because oxygen deprivation is very closely connected to the propagation of cancer cells. So if you're choking in your sleep, about 80% of obstructive sleep apnea is an airway problem.
Very, very interesting.
Tongue tie, the tongue in the back there, we can talk about that.
Yeah.
But these are the kinds of things that can be seen on a CBCT. There's 3D scan. I recommend everyone gets a CBCT. If your dentist doesn't have one, they should definitely find someone.
And they're not expensive to do those scans at all.
And then the other great thing is we do these virtual consults where you could be anywhere in the world and you can have that sent digitally, by Dropbox or something like that. And then we open it up and we can read it and tell you things that can never be seen on a two-dimensional little x-ray or even a panoramic x-ray.
Yeah.
So 3D is a game changer in the diagnostic world of dentistry.
Right. So does the 3D cone beam scan then kind of show whether or not you do have to put an implant back in?
It's a piece to the puzzle. So it allows us to see whether or not, if a tooth was taken out, and we will talk about, touch upon cavitations, but did the bone heal properly?
Right.
Do they have enough bone for a dental implant? And then on top of it, is this something that their immune system can handle right now? Where are they at with their medical status? But we, generally speaking, go for the implant.
Yeah, so that makes a lot of sense. Because then if the immune system isn't or is compromised, perhaps they need to entertain another option. Sure. Option that
I mean, in the last 30 years, 40 years, dental implants were a huge advance in restorative dentistry, right? You can get a third set of teeth. Now we actually, in human trials, we're actually using stem cells to regenerate teeth. I just posted something on my Instagram about that, and I gave some of the literature and the science of what they're doing in Japan and the UK. And everybody's saying, when can I get it? Yeah. They just started human trials.
Yeah.
You may see it, the end of the decade, but the reality is that, dental implants are a wonderful choice, but the material choice has become very, very clear that metal implants are inflammatory to the human body.
Yes.
And produce endotoxins the way root canals produce endotoxins.
So this is the way I want to get into this next. So often, or more traditionally, people are offered titanium implants. And when I was going through my experience and we were discussing what was going to be the right fit for me, I remember taking titanium materials and more biocompatible materials.
I remember giving you one.
Literally giving them to me because I was like, I'm not playing games anymore.
And I was like, go test.
I was in such a desperate situation to be healing that I was so nervous about putting metal into my bone. And ultimately, when I went to the muscle test there, my body responded well to both, but my body responded more strongly to what is known as zirconia implants. And that's ultimately what I put in. So talk to me about this material. Are there pros and cons to either? Are titanium a dated option? Do people really need to be aware of this? Tell me about this.
I did my first titanium implant in 1989. Again, taking myself. And my reaction was,
which is when I was born, by
I was 8 years old. You were born and I was 8. Yes.
I was probably a little younger than Dr. Grecco. No, I was probably your age. I remember your age. I was Dr. Grecco's age in practice.
Yeah.
First titanium implant, and it was called a Brandemark implant, but it's the founder of the cylindrical, what they called osseointegrated, which is a little kind of a misnomer now with the science of what we know. But I was fascinated because the bone grew around it, and I was like, wow, the body loves this.
Yeah.
Not. What it really was inflammatory to the system. And the bone that grew around it is what we call sclerotic bone. It's almost like scar tissue bone. Mm-hmm. It didn't have a blood supply. So sclerotic bone is like scar tissue bone. And what we found is, and then the soft tissue started reacting to the implant and getting inflamed. And then we started seeing the bone dipping around it. I'm like, oh, maybe the body doesn't love this. And then I started getting 10-year, 15-year, 20-year histology studies. And we started to see that, whoa, there's endotoxin production. There's something called peri-implantitis, which created a whole new revenue stream for periodontists, gum specialists, to treat this peri-implantitis around the implant. And then we started to see, wow, there's actually corrosion of metal implants in the mouth. Because people started saying, well, what about the hip? The hips are titanium too, and they actually have ribs. People in car accidents, get ribs out of titanium. And so we started using this titanium all over the body, like a Frankenstein.
Yeah.
There are people that walk around with titanium everywhere. Knees, hips.
You hear them when they go
to the
security machine.
Yes.
And but what we have found is that it is inflammatory. In fact, it's a source of chronic low-grade inflammation in the mouth. Saliva acts like a weak electrode, so you get this corrosion. And they actually find in the these corrosion of the implant, the particles go into the bloodstream, and they've been found in the liver, the kidneys, and the lungs. 2021, huge 21 study that came in.
Yeah.
And actually, fluoride corrodes implants, and you get corrosion of the implant and failure of the dental implants from fluoride. So zirconia has come on the scene probably over the past 25, 30 years. It's become increasingly popular. The bone that grows around a ceramic implant, totally different than a metal implant. Bone that grows around a ceramic implant is vascular bone. It has a blood supply.
Interesting.
And what's really interesting is that most dentists hate using zirconia. They find it very challenging. There isn't a lot of prosthetic attachments to it.
Why? Is it because it's like a delicate material?
Ceramic implants now are probably where metal implants were 35, 40 years ago. So the bone grows slower, but the bone is healthier.
Right.
So rather than being able to put the crown on top of the implant in 3 months, we wait 6 months.
Right. Which is literally what I said.
Double time.
So it's almost like the zirconia is more of a life force external object.
It doesn't block meridian flow, which we can talk about.
Yeah.
It doesn't produce endotoxins. The soft tissue loves it. It is definitely better tolerated, better accepted by the body, but there are fewer prosthetic components. Those are all the little nuts and bolts that go on top and you can make the caps on top of and all that.
Yeah, more
So
technique
really
sensitive.
we're just coming around, and I've been very involved with a couple of, most of these zirconia implants come out of Switzerland.
Which I don't know why that feels good to me.
Yeah, well, the Swiss have always been into
That just
precision.
feels good to me.
Yeah.
When I think Swiss, I think green, I think healthy.
No.
I do. That
Yes.
feels right to me that
Yeah.
they come from Switzerland.
That's true.
I like that.
And they are, so a lot of their zirconia implant companies are based in Switzerland. They come out of Switzerland. They are really, I've been working with a lot of these companies and helping to develop the attachments to enable more or easier reconstruction of the mouth with zirconia. So we have a zirconia implant, a zirconia post, and a zirconia crown. It's an all ceramic restoration.
Yeah.
Really beautiful.
Yeah.
Really very well tolerated by the body. It looks so natural.
Yeah, it does.
But it's still got a ways to go for widespread acceptance, because you really have to be very talented restoratively. And we work with a dental laboratory, my ceramist, give him a shout out, Roberto,
you're literally in my mouth via 2 zirconia implants.
It's true.
All right. He loves to say he.
Let's stay on track.
Yeah, but I'll give him a shout out. Roberto is he and I have been working together for over, I think, 16, 17 years. And we've really been able to develop a lot of techniques to create very beautiful aesthetic results.
Yeah,
to
like a
assist
craftsmanship.
them.
Yes.
Yeah.
Literally a craftsmanship.
It is craftsmanship.
Yeah.
But so zirconia, the biologic advantages are far superior to titanium. The restorative difficulty makes it kind of less favored by the conventional dental community who poo-poo it.
Yeah.
And go, oh, no. And, it's a white metal. Because zirconia, Zi and Ti on the periodic table are not very far apart, but biologically they react very different.
So traditional landscape needs some time and some more patience and some more exposure to it. We touched upon the meridian chart. So this was one of the most fascinating components that I learned when I was going through my whole dental healing experience. There's a chart that people can look at that's called the dental meridian chart, which literally connects every tooth in your body is connected via meridian energetic highway to a system and an organ in the body.
If they Google it, it's tooth organ meridian chart.
It is mind blowing. So ironically enough, my 2 teeth, I believe 14 and 3, were directly connected to thyroid and stomach. Mm-hmm. Those were my 2 systems and organs that were short circuiting after my second root canal in my tooth. Can you share more about this chart and understanding how the meridian flows within your body, how it can help you connect dots to maybe some health ailments that you're having?
I can take this.
Yeah.
So it's funny we're even talking about this, because when I was in dental school, my grandfather, who was truthfully one of the original chiropractors in New York, he said to me, who wrote the original textbook. Yep. Yeah. And he actually said to me, did you know that each tooth is connected to an organ? And I was like, we were not taught that. And
Voodoo.
It's voodoo. It's voodoo. And of course. And then, obviously I joined with Dr. Curatola, and I could never unsee it.
Yeah.
It's fascinating to me to have patients come in. Even today, I had someone who also had, one root canal on the thyroid meridian who has Hashimoto's. And, we use it as something, it's obviously not diagnostic, but it's very validating. Yeah. And when patients come to us at the end of their rope, can't figure out how to get healthy and what can they do to move forward? What can we, how can we, pinpoint and connect the dots, like you said, follow the breadcrumbs, listen to the whispers. Like you said, this meridian chart can be very, very helpful.
Yeah, it was wildly insightful for me. So then, is doing an implant, whichever source it is, perhaps zirconia may be better, does that impede the meridian flow, or no, it's supportive and life-giving?
So what I said is zirconia does not block meridian. Any metal does.
Yes.
So metal implants, mercury fillings. I call mercury fillings because dental amalgam, what were traditionally called silver fillings, silver-colored fillings, are 52% mercury. So it's really a fraudulent misrepresentation, by the way, to call an amalgam a silver film. Like, oh, Lauren, we're just going to do a pretty little silver filling back here. No, how about, Lauren, we're going to do a little pretty little mercury filling back here. You'd have a whole different reaction.
Yeah.
But again, the first time I heard about meridian, I was actually at the Harvard Medical School program in complementary and alternative medicine. And the guy speaking puts up this meridian chart. And he starts talking about this, and I'm looking and I see, and I'm like, come on, how does this work? This is 1997, I'm like, right. Yeah. Okay. But chiropractors, by the way, were probably some of the earliest functional medicine doctors.
Yeah.
Because, and they really get it. They were really kind of like this life force goes down the spine.
Because your nervous system lives in your spine.
That's right.
So it makes sense. And it also makes sense to me why so many chiropractors branch off into genetic testing.
Yes.
Yeah.
Yes.
So I really have enormous respect for chiropractors, because I even remember it. And actually, it was your great-grandfather. I'm sorry.
Who was my great-grandfather?
I was thinking my great-grandfather wrote the textbook.
Yep.
The grandfather, who was my uncle. My uncle.
He was a very talented man.
I was like 8 years old, and I went over to the house, and my Uncle John came over to me, and he goes, Gerald, come over here. He just takes my head and he goes, you know what? And he goes, you're not feeling well. He was like palpating my neck. Then he puts me on this table, and he's cracking my back, basically aligning my spine and this and that, because I was like this. And the next thing you know, I could breathe. I felt better. And I was in the car driving home with my mother and father. And I said, Uncle Johnny healed me. And they said, he's not. My father goes, well, he's not a real doctor. Like he's not, because he's not an doctor. Right. And I was like, what are you talking about? I feel bad. All I know is
he was a healer. Right.
Like the guy who said, I was blind and now I see,
Yeah.
But anyway, meridian flow is what chiropractors have been in tune.
Absolutely.
Yeah, for doing time along. But I remember one of the most striking examples, and by the way, your molars were the Grand Central Station of meridians. The upper first and second molars are covering like 4 to 5 organ systems.
Oh, wow.
On the upper right, it is the stomach, the thyroid, the
breast,
the stomach, the breast.
Yep.
The breast, the thyroid, the stomach, and the pancreas on the upper right, the spleen on the upper right.
I'm like seeing.
So you really had pancreas and spleen are the only two differences in the molars on each side. But stomach is right there. Yep. All these people with GERD.
Yep.
All these people with thyroid, hypothyroidism, all the stuff. But big one, big is breast.
Yeah.
And it was shortly before COVID, we had a patient come in. And she was coming in. She was referred by a patient. She wasn't really in tune with the whole biologic thing. I think she wanted veneers or something. we did a cone beam on her, and I looked, and on the upper right, she had a massive infection around her root canals that had actually gone into her sinus, which is right above the upper molar.
Yep.
You have the maxillary sinus. And literally the infection had spread into her sinus. And on the upper left, it was just a big, black, dark area around the root that was like a cyst. So the first thing I said is, hey, I just saw your cone beam. I'm a little concerned. Do you have any problems with your breast? Just intuitively, I just said, do you have any problems with your breast? And she said, I just had a double mastectomy at Sloan Kettering.
Wow.
And I said, I'm so sorry to hear that. And I'm sorry I didn't read your medical history before. I was just, your cone beam jumped out at her.
Right.
And I said, I'm so sorry, but I said, I want you to know there's something called breast cancer stem cells, and you have not gotten rid of the root cause of what's there. And I highly recommend that these areas, be treated. And it was really, really interesting. I think she got totally spooked and freaked out.
Yeah.
And refused to accept it, but sadly I never saw her. And then I was lecturing out in Newport Beach, California, and there was a functional medicine doctor there who had heard me speak, and she called me on Monday and she said, Gerry, I heard you speak out in Newport over the weekend. She was from Houston. And she said, my girlfriend Lisa, was just diagnosed with this really weird aggressive tumor in her left lung. And I said, she asked me, she said, is there anything I should ask her to look for? I said, first thing, that's a root canal. Because, honestly, not for anything. And, we kind of were very diplomatic about talking about root canals. But the reality is the number one, I think, systemic immune system dysregulator is root canal. Root canals, cavitations, heavy metals, all this stuff. But root canals can be very insidious and can really kind of flip. And if you think from your brainstem to every tooth in your head, to every organ system in your body are these channels, these electrical channels, and they actually run through the fascial, which is right on the skin, which is why acupuncture, when you get those needles, it goes right beneath the surface of the skin, but it's actually going into the fascia. That's where an acupuncture needle goes. That's where the electrical channels are. And the circuit breakers, like an electrical box, are your teeth.
Yeah.
So you pop a breaker when you have blockage, right? There's a energetic block in the energetic flow, whether it's a metal implant or an amalgam or even, there's others like jaw cavitation. We'll probably get to talk about. But those are like popping the breaker. Well, I asked this functional medicine doctor, it was her girlfriend. They grew up together and everything. And she had one root canal. And where was it?
On the line.
Lower first molar on the left side. What is the lower first molar? Two big meridians. Lung, if you look on the tooth organ meridian chart, it's lungs, and then it's and then the other one is colon. Lung and colon are the same meridian, by the way. And I said, have her get a 3D of that. Let's see if there's anything going on with that root canal. She goes to a conventional dentist, two conventional dentists, but both say the root canal's fine, it's go perfectly, and all this stuff. The third endodontist, third one is a root canal specialist. He goes, well, I think I see a little area. They're all working off of 2x2, conventional little mini dental x-ray. I said, nobody has a cone beam in Houston, Texas. I mean, come on.
Yeah.
Just go to an oral surgeon, get a 3D cone beam. So finally, she's like, I'm just coming up to you. She comes up to my office. And by the way, she was already scheduled 5 weeks after she had seen me, scheduled for surgery. And they were talking about removing all or at least a major part of her left lung.
Oh my God.
This tumor had been growing aggressively in her left lung. They were talking about taking out her lung.
Wow.
So she was already like, I'll do anything.
Right.
See what's going on. She comes up, we do a 3D cone beam, and not on the underneath the roots, but behind the roots. So, you have dense bone here and dense bone on the inside on the mandible. Where my head was a literal black area around the back of the roots, which couldn't be seen on a regular x-ray. That's why I told everybody should get a 3D count. She came up and I said, look, Lisa, this, by the way, this energetically is on a very, very renowned meridian called, the lung colon meridian. It's interesting that the lung and the colon are on the same. And like your upper molars had those 4 different meridians on each side. Anyway, we took the tooth out. I ozoned it, we disinfected it, had a huge area around it, which, by the way, every tooth we removed, every infection we removed, every cavitation we go into. We do pathology sampling. Mm-hmm. We use
mine here. We'll get into that.
Yeah, we do bioresonance testing. And she had parasites, mycotoxins. It was like a page of pathogens that was growing around this root canal.
Yep.
And 5 weeks later, she goes in. I don't know where she was going, Baylor or wherever again. I think U of T. They were at U of T Medical Center, and they do another scan on her. And she said she was sitting on the table, on the exam table, and they were outside and looking at this scan and this scan and this scan and this scan. And one of them comes in and goes, I've got great news. We could save your lung. She's like, what are you talking about? She's like, well, the tumor has shrunk to 25% of the size. That's only 5 weeks.
Yeah.
They're like, so we're only going to take out a little piece of the lobe, of the left lobe, a lobe of the lung. And of course, I would have been like, hang on. Go a few more weeks. Hang on. There's something called our divine capacity to stop getting healed. Well, we start to jump set. So, we doctors don't heal patients. Patients heal them. That we aid and assist in this amazing life force ability for the body to regulate and heal. So she had jump-started healing, and she literally completely recovered.
Oh my gosh,
But they did go in. She was in the queue for the surgery, and of course, anybody who they drop the C word on, they're freaking out.
Yeah, I would freak out too. That is unbelievable. When you mentioned mercury fillings before, I want to ask it straight up. Are mercury fillings ever okay to have in your mouth? Or is that a hard hell no?
It's a no.
No.
It's absolutely no.
Yeah. Why is that?
Well, we know that mercury is toxic. We know it's the most, is it most dangerous?
It's the most neurotoxic
element on Earth.
Yeah.
And, there's no, some dentists, it's said that, once it's hardened, that it's not releasing the vapors, but every other industry has such strict OSHA regulations, the light bulb industry, the fish industry. So why is it okay in dentistry? And, I think it was 10 years ago they started to say.
1997, I think the World Health Organization said the greatest source of environmental mercury pollution were dental offices, because dentists are putting it in and drilling it out. By the way, that was a really good question, and Dr. Grecco touched on it, is that it's never okay. But what a lot of conventional dentists say is, I've been using dental amalgam for 30 years. My patients are still alive and walking around. Yeah. Well, what's interesting is that most of us have an ability to chelate melts out of the bottom, right? And when I was invited on the Dr. Oz show, and I was on the Dr. Oz show with Dr. Oz's dentist too. And Dr. Oz said, and it was like talking about toxic fillings. And I said, first thing I said is, dental amalgam started right after the Civil War. And before that, by the way, they used to put lead in teeth. In Revolutionary days, they actually put lead.
That feels on brand for that time.
Yes. Yeah. Yes.
So I guess it was a step up going from lead to mercury.
Yeah.
Hell, but here's the thing about dental amalgam. It's cheap. It's easy to do, and it stays in your mouth for a lifetime. Mm-hmm. So what do dental insurance companies love? They love dental amalgam. They don't have to pay for it. It just stays in your head.
Yeah.
And it's off-gassing. When I was in dental school, they said the mercury was magically locked in. And on the Dr. Oz show, we showed that, basically you put a toothbrush on a dental amalgam, it's off-gassing mercury. Yeah. But is it enough to make you sick? Is it enough to dysregulate? Well, you get GI things and everything. By the way, it's symptoms of Alzheimer's disease and the symptoms of dental amalgam mercury toxicity are identical.
Wow.
Identical.
Wow.
So it's constantly off-gassing. But the greatest amount of mercury, when I did the Dr. Oz show, just to go back for that, I had a whole section. We did 3 segments. The first segment was, what is it? How much is good for you? How much is not good for you? And the answer is, none of it is good for you.
Right.
But we kind of had to kind of sanitize for the show, saying if you have 6 or more surfaces of dental amalgam, you should really consider getting it removed. And I was the guy saying, you've got to get it removed safely.
Right.
Because you just don't drill it out.
Right.
The greater, if a dentist sticks a drill into a dental amalgam, it creates an invisible cloud of mercury vapor, which is a video on YouTube called The Smoking Tooth. It's probably 20 years old now. But the miner's light, and you see actually an extracted tooth with an amalgam. You see the mercury vapor.
Oh, wow. Like the cloud around it. Yeah. That's wild.
So who are the people that get sick from a mercury film? There are people that, it's about 16% of the adult public have a variation of the APOE4 gene. It's called the APOE4 gene. Mm-hmm. And that's the gene that gives us the capacity to chelate. So these are people who can't chelate.
Interesting.
Just like the MTHFR is the one about methylation. These are people who can't methylate. These are people who have a more pro-inflammatory genotype. So things that wouldn't bother someone else, these people, they're in quake.
Yeah.
And when it really goes off the tracks, you see people, they have mast cell syndrome. They look at something the wrong way, they break out in hives. The ApoE4 gene is I think that's a very important genetic test to know if you have amalgams and you have the ApoE4 gene. These are the people that you see with MS or other neurological issues.
Yeah. The genetics is very fascinating to me. I think that's a very powerful way to approach your health from a very bio-individual standpoint. That resonates with me, especially with my understanding of MTHFR gene. I've never heard about that. That's a really
ApoE4. So those are the ones, if you have dental amalgam and you have that, you're really, but anyone who has dental amalgam, it's swap gas. Huh. The thing is, the greatest amount of mercury is really released when they're first put in, but even more when they're taken in.
So definitely opt for a more biocompatible, which I'm sure there are plenty of options for filling of a tooth. So in addition to mercury, I feel like another little bit of a hot topic can be fluoride. Yeah. Why is this such a hot topic? Why does it cause controversy in this space? I would be curious, maybe not so much for adults, but maybe for children, which I'm very curious about. You referenced the picture that you were talking about before, where everything is connected. And literally, as you were saying that, I can see the picture in my head, because it was that picture where I saw these little energetic highways, whatever they are connecting. And that's when I personally made a decision to not do fluoride for my children. For me, energetically, it didn't land right. But is it safe? Is it not safe? What is the tone on that?
Sure. So fluoride is, a tough subject, because a lot of the data that we have on it is, yes, old, but was poorly controlled. Mm-hmm. So when we see children these days and we see that maybe they're developing a lot of decay, we kind of attack it from a few different standpoints. What's the root cause? Mm-hmm. What's causing that decay? Is it, diet? Is it lack of hygiene? Is it an airway issue where their mouth is drying out during their sleep, mouth breathing, mm-hmm. tongue ties? Mm-hmm. Fluoride is not treating the root cause. So if you're not doing a deep dive on a child to figure out why are they even developing decay, then you're doing them a disservice. Mm-hmm. Fluoride, yes, there are alternatives now that are better, but if you're not balancing that oral microbiome, you're not, like I said, getting to the root cause of figuring out how to treat that first.
So
a lot of people can't believe, because there's been so much propaganda around fluoride that it's treated like it's a nutrient. Fluoride is not a nutrient. Mm-hmm. You do not get cavities from a lack of fluoride. Mm. You get cavities from what Dr. Grecco said. And it's a balance in the natural ecology of the mouth.
Very, very
interesting. And I've done 25 years of research on the oral microbiome. And as you know, I developed formulations that are now wonderful oral care products that promote balance of the oral microbiome. When the oral microbiome is in balance, there's actually a study being published right now called the SMBC, Sialomicrobial Dental Complex. This blew my mind because as a dentist, we were taught tooth decay, Streptococcus mutans bacteria are responsible for tooth decay. Mm-hmm. And Porphyromonas gingivalis bacteria, they cause gum disease. And so you got to kill it. And the whole approach in dentistry has been sterilization and then big brother fluoride, the panacea of all dental is. And the fact is fluoride's been around a long time and decay rates have really, fascinating thing is the World Health Organization had a report from 1970 to 2010. Most of Western Europe never put fluoride in the water. And decay rates fell exactly the same. I debated a member of the American Dental Association in Dallas, Texas recently. And I said, just put the graph up, from 1970 to 2010 decay rate. Belgium fell even further than the United States is really an outlier with throwing this crap in the water.
Yeah.
It is crap because it's a byproduct. They call it an industrial byproduct. It's hazardous waste. It is fluorosilicic acid, which is, by the way, dirty, and it has arsenic and lead in it. And that's where you have to wear hazmat suits and dump it into the water supply. The origin of water fluoridation was never about preventative dentistry. It was about industrial lawsuits, because what they used to do is have these byproducts coming out of smokestacks and just, killing crops and livestock and contaminated, a population. And so they put these water scrubbers into these smokestacks, and this sludge that comes down to the bottom is fluorosilicic acid. It's a waste product of phosphate fertilizer industry. Can you say Monsanto? It's a waste product of aluminum manufacturing. And it was actually Alcoa that had the EPA lawsuits in the 1930s.
Right.
And so then they found that, under this, in the U.S. Army research labs, and I think it was Grand Rapids, they found that, you introduce fluoride is a made-up word, by the way. You introduce fluorine, and it stimulates remineralization. It converts the enamel, which our teeth and bones are made of, hydroxyapatite. It converts it to fluorapatite. And what no one talks about is fluorapatite is very hard. It basically turns your teeth and bones into like glass. So you could scratch it, but it's about 35% weaker than natural teeth and bones, hydroxyapatite, which has more flexibility. So kudos to you to put the pause on that, because your kids are not going to get cavities from a lack of fluoride. They're going to get cavities from diet and nutrition, from stress, and very, very, Dr. Grecco pointed out, very, very importantly,
So
in airway health, breathing through their mouth, drying saliva. So in a balanced cyalomicrobial dental complex, saliva is loaded with the minerals that your teeth heal from, your enamel of your teeth heal from. So you have phosphorus, calcium, and phosphorus in saliva. The microbes in your mouth transport minerals from saliva to the surfaces of your teeth. That's called the cyalomicrobial dental complex. That's how remineralization happens on a regular basis. And when it's out of balance, the reverse happens. You get demineralization. So can you imagine your microbes are actually transporting minerals from saliva for your teeth to remineralize?
doing what it's supposed to be doing.
Right.
Yeah.
You do not need fluoride converting that enamel to fluorapatite, which is more brittle. And what we see, and what I've seen over the years, and that's where, I've got this perspective of looking down over 4 decades going, I had these kids with these like really bright white enamel, because the enamel looks beautiful when it's fluoridated.
Yeah.
It's like very thick. And even on the x-rays, it's very opaque. So opaque that you can't actually see under it into the dentin.
That's wild.
And so you get what's called we call them fluoride bombs, which is you get these microfractures in teeth, and bacteria kind of get through, imbalanced bacteria. So, strep mutans lives in the mouth, and it can even be benign and beneficial when the community is in harmony or balance, what we call homeostasis. When it's out of balance, now they're pissed off. And now you get these strep mutans bacteria in they secrete acid, right? And then you get like this decay forming under the enamel in the dentin. And it literally is a blowout to the point where sometimes these teeth, the decay is like right on top of the nerve. So now you have the kid getting a root canal. And yet the dentist has been looking at this for 5 years and can't see the decay.
So I think a major takeaway is that if your child is being offered fluoride, perhaps with maybe what the dentist is seeing, to have an extended conversation of, why do we think this is happening? Are there other things we should consider and look at?
Absolutely.
To try to like get to the root cause.
Absolutely.
And the crazy part is the dentists are so indoctrinated. When my daughter Grace, was probably the youngest dentist, she'd go in her 4th year of dental school, thanks to Dr. Jeannie Grecco, encouraged her because she actually went back to school, after having a BFA and being in the art world.
Yep.
She always had that, art and science thing. And so she called me her first year of dental school and she was like, Dad, they're giving us all the fluoride bullshit. They're giving them research from 65 years ago that was poorly controlled, but it's in the curriculum. And when we know something, there are 65 studies that links fluoridated water to cognitive impairment in children.
Wow.
A study from Harvard School of Public Health in 2006 linking drinking fluoridated water and osteosarcoma in male children, fatal bone cancer in male children.
I don't believe you.
There are many different
linking drinking fluoridated water, which does nothing to reduce decay. Drinking fluoridated water does not prevent cavities.
Right.
At best, you create fluoroappetite from topical application. But again, there's this problem of what are the physics of fluoroappetite versus hydroxyapatite? Which would you rather have? Yeah. Which would you rather have your children have? I actually talk a lot about how to get fluoride out of the bone because it calcifies your pineal gland. It's linked to hypothyroidism, major epidemic of thyroid disease, osteosarcoma, osteoporosis, 21 studies. There is a great consumer advocacy site called fluoridealert.org, FLURIDE alert.org, if you really want to do the deep dive yourself.
Right, and
the only thing that I would encourage my colleagues in dentistry to open their eyes. And that's all. You're not being unpatriotic to dentistry to be against fluoride.
Right.
You're being more enlightened.
Right.
And start looking at root cause approaches. Everybody, we heard root cause. There was even a movie, the root cause. So lots of men by Netflix.
I watched
that. Was another hot topic.
Yeah.
But
I literally finished watching that and came upstairs and told my husband, I'm pulling my teeth. He's like, that's barbaric. Let's pause. I was like, no, I'm figuring this out. Nobody's helping me.
That really
I was down such rabbit holes of researching and figuring things out on my own that I was like, I was on a very hard sprint and figuring things out. Yeah.
Kudos to you. And now look at.
Yeah, exactly. I will keep listening to those whispers. Exactly.
Yep.
I want to talk about cavitations a little bit. So I would bet money that the majority of people listening to this right now have never even heard the word cavitation. 6 years ago, I had no idea what that even was. When we did the cone beam scan on me for my root canal situation, we saw that 2 out of my 4 old wisdom teeth sites, I had my wisdom teeth taken out when I was, 13 years old, 14 years old, did not heal properly and had black shading. You, Dr. Sate, did my cavitation surgery. There was a gentleman there that was on site that did a swab and ran a report on me. I was horrified, similar to the other story that you shared, to learn what was harboring in that dark corner pocket of my mouth. Some of the things included Borrelia, staph infection.
That's Lyme, but
yeah.
Borrelia is
parasites. This is 2 pages deep, heavy metals, of things that were found in those 2 sites. I felt very grateful that I was made aware of this. We went in, we took care of it, but explain for people what cavitations are.
Yeah.
Is this something they need to be aware of? And what do you do about it?
It's really interesting, because Germany and Switzerland was way ahead of us on this. And they did a lot of the research. There's a Dr. Johann Lechner, who's a little older than me, but he's done, a lot of academic work in this area and looking at this. And actually, our 2 surgeons in our office are super gung-ho about starting to publish and document and do a deeper dive in publishing academic studies to educate the rest of the community and really incorporating this into dental education in the United States, because it really isn't. So it's, there was a young oral surgeon out on Long Island who actually, as you know, I love to teach. And so I use Instagram as a teaching tool, and I enjoy it. I have two, mid-20 guys who are like 20 something, the Gen Zers who are like, they were like, Dr. Jerry, do the video, walk through the drugstore. What's the mouthwash?
The mouthwash. Is mouthwash poisonous?
I got 12 million. So I'm kind of like, there's a little part of me, from drama club in high school that's like, yeah, I'm digging this.
Yeah.
But the reality is that, I did one on cavitation saying, they have it. And this oral surgeon stitched herself onto my video. They called stitching. And I said, cavitations are very common after the extraction of wisdom teeth. And she goes, that's an extraction socket, and the reality is no, it's not. An extraction socket is what's there when the tooth is first pulled. But what we expect is that for that area to regenerate bone and to fill itself in. Well, now with the advance of 3D technology, we see that these areas remain like we know now that in bone metabolism, that the cells that make new bone, the osteoblasts, and the cells that take away the old bone, the osteoclasts, that there's this dynamic metabolism. Well, what happens is osteoblasts need to be supported in a bony socket. And so we routinely recommend grafting. When a tooth is extracted, we graft in there so that there's a scaffold for the body to make new bone for the area to regenerate. Otherwise, you end up with a hole. So the term cavitation, first of all, was coined by an orthopedic surgeon in the 1930s. He was biopsying the human jaw, and he found that there were these areas, holes in the bone, where the patient reported no fever, no pain, no swelling in their history. And so it was kind of like a stealth infection. Well, what's the significance of it? It's warm, it's dark, it's moist, and there isn't a good blood supply. And if it had a blood supply, your immune system kind of cleans it up. But if you don't have a good blood supply, what you have is a petri dish for pathogens.
Like a breeding ground.
Right, a petri dish for pathogen. Very renowned biologic medical doctor, Dietrich Klinghardt. Did a lot of research on Lyme. And I remember, about 20 years ago, they were talking, if you get Lyme, it's kind of like diabetes. You just got to live with it. It's a chronic infection and da-da-da-da-da-da-da-da. He was the one who said, no, we're not taking oral antibiotics or even IV antibiotics. A lot of these people have IV antibiotics. They're not going to touch Borrelia, which you had, in a cavitation. Right. Because there's no blood supply there. It's not getting to the site. So you literally have to mechanically expose this site. And the only thing that I contributed to in the world of the treatment of jaw cavitations, and I created a protocol for it, the Curatola cavitational protocol, and I presented it to the International Academy of Oral Medicine and Toxicology. And I was like, everyone should do this, but I started using a laser with a wavelength of light. It's called the erbium wavelength of light. I started using this laser because the laser, the way they used to do it is they would drill into the jaw. That was my Long Island jaw. Drill into the jaw before sometimes I hear myself and I'm like, wow, I do have a Long Island accent. They would drill into the jaw and they would spray ozone and then close it up. Yeah. So there are two advances in cavitation that were emerging. One was the use of what we call smart blood concentrates, which are platelet-rich fiber, PRF. They were doing vampire facial, scalp treatments, and all kinds with platelet-rich fiber. Especially the younger you are, the more mesenchymal stem cells you have. So now you have your smart blood concentrate that has your body's own stem cells. And we were able to use that, and that kind of it reduced inflammation. It had actually helped with regeneration and healing. The problem is that platelet-rich fibrin will dissolve quickly if you do not it'll dissolve quicker than your body can make osteoblasts. And when the osteoblasts can make new bone, regenerate bone.
Right.
So a lot of times you still have some residual cavitation, even just using PRF. So I came up with a protocol that uses an erbium laser, so that we use the laser for three things. We use the laser to get into it atraumatically. We don't go into the cavitation with a dental drill. We go in with a laser and we decorticate the surrounding bone. So we're actually able to excite and stimulate the surrounding bone to regenerate. And the third thing we do is we disinfect. Oh, and the fourth thing, actually, in addition to that, is we stimulate blood supply.
Yeah.
Ozone brings blood to the area. So does the laser.
The blood and your blood platelets at blood,
The
right?
smart blood concentrate with a bone mineral grab.
Yep.
And a lot of people have to understand that we need a scaffold there. And there's human bone is the best. And we can take it from your own body. But at the same time, cadaver bone, which everybody goes, oh, cadaver bone, it is a temporary scaffold that gets resorbed by the osteoclasts as the osteoblasts make new bone. So this protocol that I introduced probably 15 years ago or more has been very effective in helping regenerate, bring a blood supply back, clean it out, regenerate, bring the blood supply back, and make the area healthy again.
And get the person's health back to neutral ground where they can.
We're eliminating another major source of chronic low-grade inflammation and blockage at meridian flow. By the way, the meridians, third molars, are small intestine and the heart. And we had a prominent podcaster who had a young woman who had been suffering with SIBO. A lot of people, all of a sudden,
SIBO.
You're 21 years old, and all of a sudden you have SIBO.
Right.
Oh, why didn't you get your wisdom teeth out 2 years before? Oh, what else is going on? Oh, well, I got this arrhythmia in my heart. This woman actually ended up getting pacemaker put in.
Oh my gosh.
And so pericardial tissue is regulated by the meridian on the third molar area. So does this mean, like, if you have an infection in your third molar, cause the infection in her? No, it just means the body's ability to regulate. And we regulate on a microbial, energetic, biochemical, psycho-emotional, and spiritual level.
Yeah. Well, I'm very glad, with all that being said, that I cleaned mine out and I was done with that, because that was, when I got this report, I was like horrified. So thank God that is cleaned. I want to talk a little bit about probiotics. Everyone knows that doing a really good probiotic can be super beneficial for the gut microbiome. What are the benefits of having probiotics? Are probiotics a thing for the oral microbiome?
Probiotics were tried from the 1970s in the mouth. And the oral microbiome makes it, I said, probiotics worked in the mouth, so would conbiotics. So probiotics, by the way, we used to think they were great in the gut. Now we know they're like mildly effective. It's a closed system, but really prebiotics, postbiotics. You hear all this prebiotics.
Yeah.
I've been very big in prebiotics in the mouth because I find prebiotics are really the most effective and supportive to the oral microbiome. The problem with probiotics in the mouth is that if probiotics work in the mouth, so would conbiotics. Like a progon, like we don't see salmonella setting up shop in the mouth. We see it in the gut. We don't see E. coli setting up shop in the mouth. Right. Because your oral microbiome, because it communicates with the environment outside, makes it very inhospitable for foreign bacteria to set up shop. So that's why Revitin, which even spent 20 years in the R&D and, 20 years ago, I gave a naming gift to NYU. That was 2006, before my 401k became my 101k in 2008. So when the bank and everything collapsed, and my wife was like, why did you give that gift? But I gave a naming gift to NYU in 2006 to name the Curatola Wing for Clinical Research, for really the advancement of translational research in the human microbiome, which was just really Human Microbiome Project launched, I think, 2002, 2003. It was under full swing, 2006. But everything we learned about health and disease changed into, it was as big, they called it the Copernican revolution in science, in biologic science, was the Human Microbiome Project, that we're essentially made of microbes. And these microbes run us. We don't run them.
Yeah, sorry.
And they keep us alive. And in the mouth, they remineralize our teeth. They regulate, they compartmentalize our immune system. Believe it or not, the oral microbiome regulates our systemic immune system. Our oral microbiome enables us to make nitric oxide, which is essential for cardiovascular health, for the health of our nervous system, for digestive health, for energy.
And it kind of makes a lot of sense, because when you think about food that you put in, like when you think about food being a fuel source, that's the first entry point that it hits. So it's very interesting to me that the saliva and the microbes, and like as you're talking this all through, I was like, I've never really thought about it that way. And I love your toothpaste. I even love it. I'll use it as a mask. I'll put it in my Invisalign trays.
Yes, you do.
And do all the time.
I know.
And if I ever have like any inflammation or some irritation with my posts or whatever,
Put it on.
I will literally put it on. And I will tell you by the next morning, it is completely resolved.
So, and it's so simple, in in the 1970s, the way I started with Wright in 2002, actually, no, I'm sorry, late 1990s. There was a report that I read from Japanese researchers that biopsied diseased gums. And they found that diseased gums were deficient in two important nutrients. One was well known, vitamin C. And we knew, sailors on ships get scurvy because of deficiency of vitamin C. And actually, I think it was the Portuguese or something, because they had vitamin C in what they used to use in their casks of water or something like that.
That's how it was discovered.
That was discovered.
Yeah.
But anyway, and Linus Pauling did a tremendous amount of work on vitamin C. Like if I could get rid of if I had to get rid of all the vitamins in my medicine cabinet except one, the one I would keep is vitamin C.
So,
and then the other one was coenzyme Q10, which was relatively unknown.
Yep.
In the late 90s and early 2000s. But CoQ10 is a cofactor in the production of ATP and the energy, the gas in the tank.
Yeah.
So what are the areas in the body where we need the most CoQ10? Your heart, which is why it became CoQ10 actually became a prescription item in Japan, because Japan did a lot of research. CoQ10 was discovered in 1957, University of Wisconsin, and then it was patented by Merck or something, the manufacturer's synthesis of CoQ10. And then they actually found it because they were boiling beef hearts or something. So this yellow foam coming up, and that was CoQ10. So the most amount of CoQ10, heart, skin, gums.
Interesting.
Gums.
Interesting.
Soft tissue in the mouth.
Very, very interesting.
Yeah, I mean, the oral microbiome is your first line of defense for your immune system. It's the same, you have to think of it the same way as the microbiome that lives on your skin or in your gut lining. And if you're not supporting it, you're doing your body a disservice.
Right. And there's opportunity for breakdown.
Yes.
Dr. Grecco, you and I have talked about sealants before. I'm super curious. I genetically have very deep grooves in my teeth, and my children are also genetically tracking in the same way. So they get sealants. Talk to me about, are sealants an effective way to prevent further decay breakdown? And are there other options, or is sealants a really good option to help with breakdown of a tooth?
Yeah. So there are multiple different, schools of thought when it comes to sealants. Are you just sealing off, the word is not a misnomer. Are you sealing off the deep groove in that tooth to prevent decay from happening? That's one thought. The other is the material itself. It can be a material that helps leach fluoride into the tooth. Now, when I see a child who has deep grooves in their teeth and it's very hard for them to really clean them throughout the day, kids are in school, they're eating their snacks, their lunch, obviously, the American diet isn't the best.
Yeah.
Are they more prone to decay because of all of these factors? I do recommend doing what we call a protective resin restoration on children with a really high quality material. In our office, we obviously use materials that are, the best, in terms of, being BPA free and not being, dysregulating. But we have materials that actually have, it's actually called an Ormocera that we use, and it's an organic ceramic component that's actually in the resin. But I am a fan of that in kids who are prone. It's about case selection and the materials that you use.
Yeah, I think it's been beneficial for my kids. And I feel like, because literally how they're each tracking, I'm like, something's up with this. So for me, that feels preventative to like prevent something.
All about preventative.
Yeah, from big all that down the line. Stemming off of breakdown, I have read that gluten can be a major source of teeth breaking down, which is wild. I don't know if anyone would ever connect these dots. Is this true? And is that something, if your teeth are breaking down potentially from gluten, could that also be a connecting point to maybe celiac disease?
Yeah. So gluten is the component in a carbohydrate that creates the stickiness, right? The chewiness. Mm-hmm. And can it stick in the teeth and create decay? Yes. That's one pathway. Yeah. The other pathway is not related to decay, but could be related to inflammation. Gluten can be very inflammatory to the system. Yeah. So it's kind of a double whammy. I mean, I'm someone who, we talk about this often, balance, especially in diet. Yeah. You have to be really careful. Yeah. And you also have to really think about if you're, any normal child who doesn't have these sensitivities can enjoy gluten, but we have to really think about, what toothpaste are they using? Are they drinking enough water? Are they, balancing their oral microbiome? Mm-hmm. There's so many factors involved.
Yeah, that go into it. Mm-hmm. So something that I think is interesting that is coming up, as I approach my mid 40s, approaching my early 50s, under the topic of menopause, can women's teeth take a hit when going through menopause? And what are things that you notice when women come into the office that you might say to them, you might want to get your levels checked out, or you might be going through a really biochemical transition. Talk to me about that.
Yeah. So menopause or perimenopause, which is the few years before a woman undergoes menopause, can be, they're rooted in hormone fluctuation, right? So that can cause multiple different things to happen in the mouth. It can cause, a drier mouth, which can cause someone to be more prone to decay or periodontal disease. And there are multiple things that I look for to sort of get to the root cause of maybe there is a hormonal issue going on here. So first and foremost, if someone has, something as simple as recession that causes, a little exposure of the tooth's root surface that can be causing a gum line cavity. Sometimes they pop up in perimenopause and all of a sudden all these gum line cavities are sort of a red flag for me to see what could be going on hormonally. Do we want to get this checked out? And then periodontal disease. So and this is why I always ask and I always try to find out what, someone's current DEXA scan or bone density scan is revealing, because it could be pointing to a start of periodontal disease or loss of bone density around the roots of the teeth. And you just don't want to miss these things, especially at that stage of life. The other thing is, systemic cause that could be wreaking havoc on someone's hormones is the potential for sleep apnea. During that phase of life, women can sometimes come in and they maybe have undiagnosed sleep apnea, and it's sort of, throwing like lighter fluid on the gas of a hormonal dysregulation because that regulates during sleep. So we always, there are so many standard things that we offer in our practice, whether it's a salivary test or a sleep study, or I recommend seeing a functional doctor and getting your levels checked and a DEXA scan to see what your bone density is like. And then of course, working with someone who is going to, treat the root cause of all these issues before just, throwing spaghetti on a wall and writing a prescription.
Yeah. It's interesting that the mouth, in addition to the gut, can also be like a trigger point for hormones and connecting dots in menopause.
Yes.
Is mouthwash poisonous? True or false?
It depends.
It depends.
But most commercial mouthwash is total junk.
Yeah.
And poison. Yeah. I mean, it's really interesting because I got a letter from the New York State, that the New York State Dental Association Council on Dental Ethics. And it was really, and it said, your recent video, because it went to 12 men, I guess Procter & Gamble, and one of them called.
Oh, gosh. Yeah. For using poison.
You said it's business. And I said, well, To be honest with you, any mouthwash that has sodium fluoride in it,
Or alcohol.
or alcohol.
I know sometimes I think people think the more it burns, the more it's like,
Doing something.
That was my mother. My mother was
Yes.
a Listerine freak.
The brown Listerine
Couple
too.
months.
Yes. Yes.
And my mother's like, it burns. That means it's working.
Yeah.
No, it's working.
Yes.
It was literally
burning it out of my
it was
mouth.
all
Yeah.
up
It's
cocktail.
cinching your
Like,
gums.
microbiome.
Yeah.
It was, but anyway, no, I said, to be honest with you, yes, most mouthwash is poisonous because it has,
we were taught
there's a poison control warning on the back mandated by the FDA that says keep out of reach of children. If more than, if it is swallowed, contact the poison control center immediately.
Right.
I said, the reality is that, and they're like, and you said it's harmful. How is it harmful? Well, you destroy, most antiseptic mouthwashes, the ones that say kills, I think I was holding one that said kills more bacteria than any other mouthwash and everything like that.
Yeah.
That's a good thing. Kills more germs. Okay. That's the old sign that kills germs. Meanwhile, those germs keep us alive.
Right.
We don't want to kill them.
You want an equal balance.
We want to make peace with our microbes.
Right.
They keep us alive. But anyway, that was the one that came back. And anyway, I sent 12 clinical research studies, peer-reviewed clinical research back to the Dental Society. Never heard from them again. But this is the kind of ignorance that goes on.
Yes.
They're not, yes, was it, definitely getting attention? I said the purpose is to get people's attention.
Right.
And then after that, it's to give the data and the science so they understand that you don't. By the way, antiseptic mouthwashes, and we finish that statement, in 2 weeks, in just 2 weeks of use, destroys 92% of the body's ability to make nitric oxide.
Wow. So there's like legit stuff behind
Legit.
this.
It's legit. And you will hear more MDs saying, don't use commercial mouthwash. Don't use commercial. Man, mouthwash, it was invented. You don't need mouthwash to have a healthy mouth. The reason your breath smells in the morning, the reason why your mouth is gunky in the morning is because your microbiome is out of whack.
Right.
Every day that you use a detergent toothpaste or an antiseptic mouthwash, you're disturbing and stressing that oral microbiome even more. By the way, there was a study in the 1980s. Listerine used to have, people used to tell me, I use Listerine, because I said, you can rinse with Johnny Walker. It'll taste better. And it'll do,
Make it a little buzz out of
do
it
the
too.
same thing. But the reality is that mouthwash was an invention for a cosmetic purpose, which you don't need if your oral microbiome is healthy. One of the biggest things about Revitin, and, not to do, shameless self-promotion here, but the beautiful thing about Revitin and what I get from many, many people who use it is that, I wake up in the morning, my mouth still feels clean. Mm-hmm. Because when the oral microbiome is in balance, it's a thin, clear, odorless film. And when it's out of balance, it's a thick, sticky, smelly, gunky,
Right.
peel off your teeth in the morning taste.
Yeah.
That you don't even want to, kiss your spouse or, anyone good morning until you brush.
Yeah.
And that's because the oral microbiome is every 24 hours, it's getting disturbed and denatured.
So maybe the takeaway for people is, as we are working on freshening our breath, while we're working on balancing our oral microbiome, let's be more mindful of ingredients
Yes.
that we are purchasing and putting into our mouths as we learn and transition
Absolutely.
and figure out what works. I want to talk about a little bit about pregnancy. If women are pregnant, how often should they be getting their teeth cleaned and why?
So pregnancy, there are a few things, right? So pregnancy, you have this massive hit of hormones, and it can cause the gum tissues to become ultra sensitive to things like plaque, or any, disturbance. And you want to make sure that you're getting a cleaning at least every 2 to 3 months during pregnancy. And that's to prevent pregnancy gingivitis. It's important. And I think that,
It's a real thing.
it's a real thing. And there's also a hormone called relaxin that loosens the joints. It's how the body prepares for birth. And when that specific hormone starts to really rise, then you really have to make sure that, you're really taking extra care of your gums because, I don't know if you've ever heard sometimes pregnant women will say towards the end of their pregnancy, oh, I feel like my teeth are shifting. It's the relaxin. It's the change in you might feel a little change in your bite or something that's different. Yeah, it's actually quite common.
Wow.
But it reverses.
Yeah. And then just in general for people, how often should people be getting their teeth cleaned?
I mean, we say once a season. I mean, at least every 3 months.
Twice a year, brushing floss with Crest and go twice a year.
Yeah.
That was invented by the toothpaste makers.
Yeah.
There was no science
Right.
behind going to see your
Right.
dentist twice a year.
And that's what insurance covers.
Well, yes, exactly.
Yeah.
And that's
Yeah.
behind it all. I used to be a twice a year girl.
Yeah.
Right.
And then when I had my 2 implants,
Oh, you're more than that.
I am way more than that now because I will not get on another ride to hell.
Yeah.
I have to keep my mouth in absolute tip-top shape.
Yes.
So-
Yeah, I created these membership plans, in the practice where basically it covers 2 cleanings for free
Yeah.
because
It's great.
getting a seasonal cleaning that's the least costly, the best preventative thing you can do, especially, in our office, the kind of, comprehensive cleaning we get. We have 2 amazing hygienists.
You love your Janice and Courtney. We know that.
Yeah, my girls.
You really get a good, and Courtney, a Virgo like you.
Yes.
Yes.
Yep.
Like you, but she obsessed.
You've got good eggs. You have a lot of good eggs, but you're Virgo eggs.
The Virgo. We have so many Virgos.
It's true.
It's great because they're the most perfectionistic.
They are perfectionists with
And-
attention to detail.
Yes.
It's wonderful.
And Janice stops at
one of the
nothing.
things one of the things that a good hygienist, and this is the key to a good hygienist, I've kind of mentored many, had many work with me over the years. The best hygienists are 2 things. They're gentle and thorough.
Yeah.
You can't have one without the other.
Yeah.
There are hygienists out there who are gentle and they're not thorough.
Yeah.
And they like go above the gum. Then, okay, Susie, see you in 6 months, this and that. Meanwhile, there's, calculus under the gums, which is causing, an advancement in periodontal disease and destruction of the periodontal ligaments because they're gentle and not thorough. They don't go beneath the gum. I tell everybody, you never see rats on a highway. You see them in the subway. You need a subway cleaning, not a highway.
Yeah.
And then the other one is thorough. There are those there. So there are hygienists who are gentle and not thorough, and then there are hygienists who are thorough and not gentle. And they're like Nazi torturers, and you don't want to go back for a clean. So really, when you're gentle and thorough, it becomes a pleasant experience.
Yeah.
You should love
an
it.
enjoyable visit. And one of the most preventative things you can do.
Yeah. Your girls are gentle and thorough. I had a popcorn kernel.
I'll
There was Janet up in there in between my, the crown and the post, and that Janice got it out. She's like, I am not stopping until I get this out because it was causing major inflammation.
She even took a picture of it. I remember.
She got that out. And so they are very gentle and very thorough. I always like to, whenever I get my teeth cleaned, like whenever you kind of see maybe the little spaces between, I'm like, that's how you know nothing was left behind.
That's true.
That's like my
It's
sign
true.
of a good
I
janitor.
had a patient who came to us. She goes, I just had a cleaning. We have that camera, the 8-year-old camera that went in there. Like the back of the teeth was still there were no spaces between the teeth because it was all calculus, hard, calcified flat.
Yeah.
And so, it's important to be gentle and thorough, and it is not an unpleasant experience.
Yeah.
And again, we do these rejuvenation dentistry membership things, and
That's true.
And the membership, I deliberately throw all that stuff in there that people go, oh no, my insurance only pays twice a year or whatever. No, if you did dentistry by insurance, we'd all be missing teeth. Look.
Hello.
Yes.
That's the whole biological approach. Do what works for you, not what somebody else tells you you are supposed to do. Like that is a major intention that should be set for 2020.
One of my favorite expressions is, good dentistry may be expensive, but not as expensive as bad dentistry.
Well, and I can tell you, when you have a real problem on your hands, it gets expensive. So I will sing it to the clouds. Just take care of your mouth, get your teeth cleaned, be proactive, do the cone beam scales, get ahead of it. Have really good people working in your mouth that you trust and you feel safe with, and it can really be a pleasant experience. Mm-hmm. I literally feel like we could go on for 2 more hours. You'll have to come back for another episode.
Part 2.
If people cannot get to your practice in New York City or the Hamptons, if they can't fly in for somewhere far, how do people find a biological dentist? Is there a database that they can look in? What are accreditations that are safe?
That's the Wild West right now.
Okay.
And I mean, full disclosure, Lauren, I hope the next time that I come to, and I'm happy to come to for you at any time. And actually you might even want to have some of the, the other dentists, because it is such a vital part of total body wellness, total health. But one of the things, I'm in one of my life missions at this stage, and everything I'm doing from this point forward is all about, really mentoring and legacy building and things like that, and programs that can really, the two things that I really, really prayed for before I leave the planet, which hopefully is not soon. But the two things I really prayed for was, one, change the way the profession is practiced. And that is creating an institute, hopefully at NYU. I could create a Curatola Institute for teaching the principles and protocols of biologic medicine and biologic dentistry. I'm amazed at how many really prominent biologic dentists want to join me around the country in supporting this and being a part of the faculty of this, because then we could create a certification program. Then you can have biologic dentists that are vetted in Texas and California and Northeast and anywhere in the country. And initially I was like, gee, maybe I should build centers in all these places. And I'm like, no, we just got to really mentor and teach. And there really, we are in this together, and I know there's such a groundswell of interest in this. But to answer your question, one of the most effective things we do in helping to guide patients to get to the right place is do a virtual consult with our office. So, my recommendation is that a virtual consult will be one of the best investments a patient can make, because you could be in Texas, California, Wyoming, Kansas, wherever, and you could literally send in a 3D scan, send in some of your records, and we could sit in 45 minutes, give you a wealth of information. So now you are armed to go to whatever so-called biologic dentist, and we'll even help you vet that. But you are now armed and informed. Like there was an old commercial in our area here for Sims department stores. An educated customer, an educated consumer is our best customer. Because you're educated. And the best way to get educated is do a virtual. We can educate you.
I love that. And then
you are empowered.
And then they can advocate for themselves. Absolutely. That's very, very smart. Thank you both very much for being here today. This was a wealth of information. I learned some things, and I know that the listeners are going to have many, many takeaways from this. Rejuvenation Dentistry is the website. We'll list that in the show notes. I will also list your Instagram handles, and I'm just very, very grateful for both of you. I love you to death. You already know that. I think your legacy is beautiful and one that will absolutely come to fruition with the Institute. And you are already well on your way on changing the landscape. And this world is lucky to have both of you. And I'm lucky to have both of you. And thank you very much for being here today.
Thank you for having us. Thank you.